Hey everybody, and welcome back to my channel. If you are new here, I go by the name of Ash the OT. I am a pediatric occupational therapist, and this channel is all about providing you education in regards to early childhood development. But without further ado, in this video, I'm going to be sharing with you some things that you should expect if you are ready and preparing to get your child a OT evaluation. So by this time, you've already made up your mind and came to the conclusion that your child could in fact benefit from an OT evaluation. And just a side note, if you still are not sure or you're questioning whether your child should benefit or could benefit from an OT evaluation, I have made a separate video in regards to that topic specifically. So I'll leave a link to that video in the description below, as well as at the end of this video. But in this video, you are at the point where you've come to that decision that your child needs OT. You have sought out your physician's approval and also have received a referral from your physician, and you've also found the OT or the clinic that is going to be doing the OT evaluation. And now you are trying to figure out what is going to happen or take place when this OT evaluation occurs, because maybe this is your very first time getting your child evaluated by anybody and you just have no idea what to expect. So one thing that you can expect is lots of questions. So your OT evaluator is going to have a lot of questions for you in regards to your child and their background. So they may ask you questions about their medical history. They may ask you questions about their developmental milestones. Of course, they're going to ask you questions about the concerns that you have for your child. They will also ask you about the day-to-day and the ins and outs of what happens from the time your child wakes up in the morning to the time they go to sleep at night. They will also ask you things about your family history, your social background. Another question that is often presented, but surprisingly kind of throws the parents off, is what are your child's strengths? So this is a question that your OT evaluator may indeed and should actually find out from you as well, in addition to the concerns you have. But there's been numerous times where I have asked this question to parents, and it's kind of taken them a minute to really pick out and verbalize the strengths that their child has, because they have been so caught up in the concerns and the difficulties and the challenges that they see day to day, that sometimes picking out and pinpointing the positive things is kind of tricky for them. And that's not to point fingers or point the blame, because we are the same. As adults, it's so easy for us to pick apart all the negative things that are going on in our lives, but sometimes it's a little bit more challenging to sit back and reflect on those positive things. And the same thing goes with children. So one thing I would say is, if you are preparing to get your child an OT evaluation, not only have your list of concerns ready, but also have the child's strengths ready as well. Another thing that you can expect during your child's OT evaluation is some type of formal assessment. A formal assessment is some form of a test that looks at particular skills that your child displays. So some tests may look at fine motor skills. There's tests out there that look at visual motor skills, visual processing, self-help skills, and there's even questionnaires out there that also ask questions in regards to your child's sensory processing and the challenges that may be associated with that. So there is a wide range of assessments, and which assessment that OT decides to give your child depends on a wide range of factors, but particularly a lot of them depend on your child's age and the main concern that you're having and the concern that the OT may be seeing as well. Another thing you can expect during your child's OT evaluation is clinical observations. So these are observations made by the OT evaluator. The OT evaluator may sit back and make some observations by observing your child play and interact with different toys or interact with you or their siblings. The OT may also interact with your child to also make more observations. They may observe how your child is socially. They may observe your child's motor skills. They may observe how your child is just engaging in their environment. And this is not so much a formal assessment, but just overall like clinical observations that your therapist or your evaluator may include in the child's report as well. Collaboration with the plan of care is another expectation you should have. So this means that once your OT evaluator has completed the formal assessment, made their clinical observations, gotten as much background information from you as possible, they will come to a conclusion about what is an appropriate plan of care for your child. And typically, the plan of care should be in collaboration with you. So the OT evaluator and you will sit there and discuss what was seen during the evaluation, what the overall concerns are, what your primary goals are for your child, and the therapist or the evaluator will indeed come up with some particular goals that should start to be addressed once your child begins OT, if in fact they qualify. So with that being said, if your child does qualify for OT, that's another thing that will be discussed in the evaluation. Because on some occasions, your child may not qualify for OT. The evaluator may suggest a completely different type of therapy for your child, or no therapy at all, but may still provide you with some strategies based on your concerns. But if your child does qualify for OT, then your OT evaluator may also give you recommendations. And recommendations may include recommendations for additional types of therapy that the child may benefit from to also help with whatever concerns you're having. The OT evaluator may also make a recommendation as far as what are some strategies that you can get started with right away to start addressing your concerns for your child. The OT evaluator will also make their recommendation for how often or the frequency of visits that your child may benefit from having OT. So they can qualify your child from anywhere between once a week, every week for a 30 to 60 minute session of OT. Sometimes OTs may recommend twice a month or once a month. It just completely depends on your child and their specific needs. But during the OT evaluation is also when you should be able to find out more information about the frequency of the visits and the projected amount of time that your child may need to be in OT. So once you've given the background information to your evaluator, your child has went through the formal assessment, the evaluator has made their clinical observations, they have discussed with you the frequency of visits that they recommend or any further recommendations that they have. Something else that you should expect is further information about the next steps. So sometimes the individual that is evaluating your child for OT may or may not be the therapist that is going to continue seeing your child for the actual therapy services. It just depends on what type of setting your child is in or what type of setting your child is being evaluated in. Sometimes the evaluator that has come and did the evaluation will be the actual therapist that is going to continue seeing your child, but in some cases they will not be, and there will be a different therapist that will come in and see your child for ongoing. So this is something that you may want to clarify once your child has been evaluated by the therapist or the OT. Something else that you will want to find out during the OT evaluation is how to go about scheduling your first session. You should also ask about how to prepare for your next session or the first session that your child may be having. The therapist or the evaluating OT will also let you know whether or not the report that they are doing has to be signed by your physician in order for you to start. They may explain to you any insurance requirements in order for you to actually get going with your treatment sessions. And also they may share with you when your report will be available or when they should expect to hear back from you as far as what the scores reveal if their child did complete a formal assessment on the evaluation. So this has been a lot of information for you all in terms of what to expect for your child's first OT evaluation. I also want to remind you to don't forget to ask your questions as well. Obviously, the evaluator is going to come in and ask you tons of questions, but if there are any questions that are lingering or anything that you may be wondering about, don't forget to ask those questions as well. And just in case, you know how sometimes like we don't have any questions and then 5 minutes later or the next day we'd be like, oh, I should have asked that. Make sure you get the contact information of the individual that's evaluating your child. So that way, if an additional question does pop up, you can feel free to reach out to that therapist to ask the question that you may have. And just as a reminder, if you are still unsure whether or not your child needs OT, I will link that video in the description below, as well as at the end of this video. And if there's any additional information that you guys may be having in regards to getting your child evaluated for OT, please don't hesitate to leave your questions or your comments in the description section below. And thanks guys for watching. Please subscribe if you want more videos and more content in regards to early childhood. And thanks for watching. Until next time.